Dan Glass, activist of ACT UP London. What is the politics not doing now to face this problem of AIDS?
So tonight we're doing HIV Hep C Blind Date on World AIDS Day. We're part of ACT UP London, which stands for AIDS Coalition to Unleash Power. The reason why we're doing this tonight is we're in the period that's called the second silence. The first silence being in the 80s, the second silence being now, for three compounding reasons. One, the rise in transmission levels. What the Health Protection England report recently said is record levels of transmission. In the gay male community in London, it's 1 in 7 on the gay male scene is HIV positive, 5 new diagnoses every day. But that's by no means the whole story. There's, amongst middle-aged straight women, for example, there's one of the highest rates in transmission levels, record levels of diagnoses. All the whilst there's massive cuts to HIV education and prevention services. Recently in Oxford, 100% cut. In London, up to 40% cuts. In Wales, up to 80% cut, which is nonsensical whilst there's a rise in transmission levels. And the third compounding reason is that people believe that HIV and AIDS was something resolved in the 80s. So this is why we reformed, to put HIV and AIDS back up the political agenda, because our goal is to fight until there's an HIV and AIDS cure for everyone. But we're a long way off from that.
Greg is an activist of ACT UP London. ACT UP is an organization which started in New York, now is also in London, and it's an organization to fight AIDS. What's your plan?
Well, the AIDS activism movement has changed somewhat. Originally when ACT UP came around and first set off, people were literally dying, and we're not dying anymore. So ACT UP's original slogan was united in anger and silence equals death, and nobody's dying now, so we need an evolution of activism. So we're in a new era of activism.
So now your targets are?
Targets are always the same. They never really change. Targets are big pharma, government, health organizations, particularly pharma. There's a very big profit point against human quality and human price of it's beneficial for them for us to be ill. That generally seems to be the way the world works, and obviously government and pharma, big business is tied in with government, and so government looks after big business and pharma is a business. So
what about eradication? Are governments doing enough?
Eradication, it depends on what you're talking about. I hate the word privilege, but I'll use it. We are very privileged here in Europe, particularly in the UK. We have a free healthcare system, the NHS, that will provide the utmost of care for you if you become ill or become HIV positive. It really depends what you're talking about. We can eradicate AIDS. We have the tools now. If we can get HIV positive people onto effective antiretroviral therapy that will suppress the virus to an undetectable level, they're no longer, a HIV positive person is no longer infectious. If you combine that, treatment at point of diagnosis, obviously, and if you combine that with PrEP, the new preventative measure for HIV, which is branded Truvada or generic PrEP, tenofovir EM, the chances of a HIV positive or HIV negative person contracting HIV is pretty close to zero. So treatment is prevention, and an undetectable viral load brings the risk of transmission to zero. PrEP for a HIV negative guy takes the risk of contracting HIV to zero. Therefore, we can stop AIDS now, today. It will take a little time to filter through, but we have the tools today.
Can PrEP be an alternative to condom?
If there's no HIV, if there's no HIV on the menu of possible infections, what's the need for a condom? It's kind of radical that I'm saying that, but everything else, you can take a pill or an injection. Okay, we have resistant gonorrhea, which is a concern. I'm not advocating for one or the other. It's not an either or with PrEP. It's an and. It's an extra HIV protection. But if every other curable STI is out there, and you can catch those from oral sex. Any STI you can catch from oral sex. How many people wear a condom for oral sex? So the condom versus PrEP, it's not a battle. It can be both. But ultimately, I will put my neck on the line and say, if you take HIV off the menu of possible infections, what's the need for a condom? You can use both for sure.
What about the NHS? Is it giving PrEP?
Currently, the NHS does not provide PrEP for free. There are ways to source PrEP. To start with the NHS, they're due to make a decision. They were originally due to make a decision in April 2016, and I would imagine the outcome of that decision would be rolled out pretty soon after the decision. However, it's now been pushed back to June 2016, and that looks likely to be pushed back even further. So in the interim, I have created a website called iwantprepnow.co.uk, which allows you to import generic PrEP for £45 a month. So that will do in the interim, but France just last week sanctioned the go-ahead for PrEP to be made available to people at super high risk, which is men who have sex with men, people in the sex industry, trans people, because they're almost twice as likely to contract HIV as any other risk group, and then people who inject drugs. So ironically, they used our UK-based PROUD study to get as leverage to sanction PrEP in France. So there's a decision due in June 2016, and we'll wait to see what happens with that. The NHS, the people in the NHS, the clinicians, will try their best to help you stay HIV negative. I have no problem with the NHS. It's the powers above them that are slightly conflicted.
Alex is an activist of ACT UP London, but he's also the co-founder of a website about PrEP. And you said that PrEP is blocked by bureaucracy in the UK. Why?
PrEP has not been made available on the NHS yet, and we are years and years behind the USA, for example, where it's been available for free in certain cities there. PrEP needs to be available immediately because it's hugely reducing HIV transmissions to in any areas where it's been made available for a very low price or free. In the UK, HIV transmission rates are currently rising, not falling, and so there's even more of a need to be made available now. The NHS are not making it available immediately. They're waiting and waiting. They're making a decision in June 2016 at the moment. That's likely to even delay things further. Many charities and ACT UP London and iwantprepnow.co.uk have all been calling for the NHS to make it available immediately, as the evidence that it stops HIV is overwhelming, and it's now causing needless HIV transmissions.
What about the public opinion? Is it aware of PrEP or not?
Many people in the UK are not aware of PrEP because it's a new way of using an existing drug. One of the main battles to make PrEP a success is education and to raise awareness of it. In the US, where there is a high awareness of it, a large number of gay men have gone on PrEP, and transmission rates have started to fall as a result. In the UK, we need to first of all make it available for free or very cheap. We need to make it available for free on the NHS, and we need to then start campaigns to raise awareness and educate people about the benefits of going on PrEP.
Is anyone talking about PrEP in the schools?
HIV education does not exist in schools, and that is one of the reasons why transmission rates are currently rising. So we need to immediately have HIV education, same-sex education, and education about the current state of affairs with things like ways to prevent HIV.
What about sex workers in the UK? Are they aware of it or not?
Not many sex workers are aware of PrEP, even though you can currently get it from overseas, not through the NHS. All sex workers are at high risk of HIV, so pretty much all sex workers need to consider going on PrEP, as it will save a lot of needless transmissions.
Let's talk about PrEP. Some activists abroad say that it is not necessary because we have already condom, and this is, however, a medication. And so it's no need to give a medication for someone who has not been affected by HIV.
People like having sex without condoms. If we had condoms and that was the solution, HIV and AIDS would have gone a long time ago. But people like having sex without condoms. And so we have to understand where people are at. And PrEP is a very important tool in our weaponry, all of our weaponry, as one of the tools to stop the spread of HIV. So we're fighting for HIV, like France has allowed it free on the National Health Service, as well as America. England is way behind the times, and we should be allowing PrEP free for all, because otherwise people are going to get HIV, and the costs for treatment are a lot higher than in for prevention. So it makes economically no sense for PrEP to be costly for people living with it. People are going to die if they don't have it, because one of the other issues that we're fighting on is supporting HIV positive migrants to get the treatment they need, supporting PrEP, supporting HIV positive women to fight against the cuts to domestic violence services, because one of the highest rates of transmission for women is domestic violence and gender-based violence. We're fighting on all fronts because we've got to, because the government are not doing enough. ACT UP are very different to a lot of HIV mainstream organisations, because we look at the root cause of what's going on, which is government inaction and the irregulation of the pharmaceutical industries, and we use confrontational street activism to fight them rather than lobbying them when we think they're immorally wrong.